So, since I'm not going to tell you a very detailed theoretical aspect of each of these systematic review and meta-analysis, generally we will be talking the content which is very relevant for you to frame something and to, because at the end of this workshop, we are expecting that few of you who are very much motivated should develop a protocol and get it registered to Prospero so that you can start your own systematic review and meta-analysis. Few of you have already done it, like Priyanka was saying, like she has already done to SRMA, so she knows all these. But rest of you who are planning or who are stuck like in between, you can just move one step further. So coming to this research question, so the first question on this systematic review and meta-analysis, so like I said, that you have to go and form a research question on your own. So once you start, thinking on doing this systematic, because that's why you have joined this workshop. Something is there in your mind and you just want to translate it into practice. So how to formulate that idea which is there in your mind into a question and into a proposal so that you can move forward. So taking you from that step ahead, we have planned this session, and you can see there are two handbooks. You can see one is the Cochrane Handbook for Systematic Review of Interventions. This is available online. You can refer to this book. And the second is Finding What Works in Healthcare. That is again a standard for systematic review. These are the two books which you can refer. And that's the content which is there online. And we have also shared for meta-analysis one handbook of the Borenstein that you can refer for the meta-analysis. So these are the three standard books which you can refer. So now, since all of you are a researcher, I mean, there are people who are very senior. So I hope that you must have done a lot of researches and you are very, very well versed in a particular research technique, whatever you like. Probably it's a randomized control trial or observational study or whatever study design you must have chosen in the past. So now, if I just want to understand what you know and just want to take you to the unknown world of this systematic review process. So how, if I just start comparing these two processes, how I can go about it? So if I see this original research study, so research study, you have an idea and you know how to go about it, how to translate that idea, and you all have a lot of publications in your hand. So now if I want to do the meta-analysis or the systematic review, the same studies which got published, not mine, anybody else also, that will be the unit of my study in case of a systematic review. So if you talk about a subject, then the individual study unit is the study of my unit in the systematic review. So if you see the original research study, in original research study also, we always start with the research question. So we always say that yes, a good RQ answers, if you find the answers of a good RQ, definitely you will achieve a lot. And how you find that answer? Generally, you try to see the gap which is there in the existing literature, and then you frame a particular research question. That's what we have been doing till now. So in systematic review process, how this is different from the original research. So in systematic review, again, we form a review, since the name says systematic review. So here, generally we say a review question. You can also say it as a research question. So we form a research question or review question based on PICOTS, which we will see what is this PICOTS. And again, we find this research question based on the some gap in the already existing systematic reviews or meta-analysis or in the study, whichever they are in the domain, in the literature domain. If you think, if you understand this search of evidence, so where do we search the evidence in case of original research? So we collect the data. So we collect the individuals, we collect the data from the patients. We can collect it if it is an observational study or it is a field-based study. We go in the field and collect, we do a survey. If it is on the study unit, the patients who are hospitalized or they're in a critical unit, then we collect the data on those patients. Similarly, in case of a systematic review, we search database. So we search and we select database and we search, because I said that unit of study is the individual manuscript in case of a systematic review. It is not the patient. So you have to search for that particular manuscript or study in the relevant database relevant to your research question. In case of our original research, you recruit participants based on some inclusion criteria. So we formulate like this person I'm going to include if it is an intervention trial. So there are some laid down criteria for including that particular person or excluding that. Similarly, in case of a studies, because I said that the unit is the study, individual study. So I have to lay down a very, very detailed criteria of which study I will include in my systematic review and which study I will not include or exclude from my systematic review. So again, inclusion exclusion criteria is there in case of systematic review also, but that is more you can say it is very thorough, because here what you are working in a team, and we'll say that the more specific you are in laying down these inclusion and exclusion criteria, the more good quality studies will come into your final review. Then the next is you gather data from the participants, like we have seen earlier also, that you take the data from the patients or from the community, or if you are doing it on the secondary data, then you collect the data from the records. But in case of a systematic review, you extract the data from the key study, which you have finally included in your systematic review process based on many guidelines, which we'll see later. And in data analysis, we use the statistical method, like it can be descriptive statistics or inferential statistics, depending on our research question and depending on our objectives, the primary and secondary objective. Similarly, in case of a systematic review, this part may or may not, because in case of our original study, if you don't have data analysis, you cannot move further. It has to be there. It is mandatory to analyze your data in case of our original research. But in case of a systematic review, it may or may not. Why? Because once you synthesize, you see that there are many publications who says that yes, they cannot do a meta-analysis because of a lot of heterogeneity in the studies. Because here you can't do anything. Whatever is the published, you have to take decision from those published manuscript or published studies. So that's why meta-analysis can be possible, or there are scenarios when the meta-analysis was not possible, or in your case also. So that you have to see. So statistical analysis part in case of a systematic review is known as the meta-analysis, and you perform the meta-analysis of the pooled result, which may or may not be there in every systematic review process. And then in case of original research, you again do a quality assessment. So like whenever you perform a randomized control trial, you see that there should be randomization, there should be treatment, allocation, whatever you are doing, or treatment allocation, that should not be known to the participants and to the doctor who are giving the treatment, to minimize the observer bias, to minimize the recall bias. So a lot of biases you take care of. And in case of a systematic review, how you do that? In case of a systematic review, you have got a checklist. So basically, you send the studies to a set of reviewer to assess the quality of study, which is known as the systematic this assessment, quality assessment, or the risk of bias assessment. There are various tools for it, and we'll see what are the tools through which we can test these risk of bias of studies, and then we present our result. So you show the result in the form of a table with confidence interval. Similarly, if you are performing a statistical analysis on your systematic review study, which is the meta-analysis, then you show your result in the form of a pooled outcome. And then you also show in the form of a forest plot, and you show the confidence interval of that diamond or the pooled result of all the outcome which you have defined in your systematic review process. So that's how the similarity or the differences. So it's just the comparison and contrast of a systematic review and meta-analysis process from a traditional review or an original research study. And in interpretation also, you discuss the finding, you identify the limitations of your study. In the systematic review and meta-analysis also, once you synthesize the evidence, you again discuss the limitation of your systematic review process. So we will see towards the probably second day that how we report this systematic review. And there is a Prisma guideline for reporting this systematic review, and in that according to that guideline also, you have to highlight the gap in your review process, where what was the process. And that's why we always talk of keeping this review process very transparent. So that's why Cochrane, who's the highest global body for this systematic review and meta-analysis. And if you go through the handbook, which is there in the this domain Cochrane website, then you will see that they highlight a lot about this transparency process. This whatever you are doing, you should document that. So that's important in research as well. Whatever we are doing, that is expected from the scientific community, that you should tell the truth, or you should be very transparent to the scientific community. So now we have learned about this systematic review, but there are other reviews also. So how this systematic review is different from the other reviews which are there. So you must have learned about this narrative review. So we all, in some or the other part of our life, have done this narrative review once, or maybe even not done, then have gone through it or read it. So that is the traditional narrative review. Then comes the systematic review. Then there's another review, which is the rapid review. And then there's another type of review, which is also known as the scoping review. And then meta-analysis is, although different, it is not a review, rather it is the statistical pooling of the result, the qualitative synthesis which is there in the systematic review. So now coming to this various types of reviews. So if you see here, I'm just going to compare these review with the movie analogy. So if start the topic which has been allotted to us, I mean, in all these 3 days, we'll be working on the topic which is the probiotic and diarrhea. Like children, if you see the research question, we have shared the protocol with you also, and I hope many of you have read through or gone through that protocol. So the research question is that the effect of probiotic on the mean duration of diarrhea in children with acute diarrhea. That is the health topic. So if I have to do a review, so we'll see the various type of review, and like if I have to review this movie, which is the Spider-Man, Across the Spider-Verse. So just if I want to compare through that review, because movie review also, that there are ratings and there are people who do this rating of the movie. So if you see the traditional review, so how do we do a traditional review? So generally there is a question in our mind. Initially we used to go to the library, we used to search for the articles, and the articles or the manuscript which was very much in line with our thinking. So we go with a biased thinking in case of a narrative review, and we have our own question, and we will select those articles and we will put our viewpoint. So it is not a very neutral point, and generally we put our biases whenever we try to do a narrative review, because the process, it is not very transparent and there's no clear-cut guideline how you should be doing a narrative review. So we just summarize the existing research, and it doesn't strictly follow a systematic method. I mean, it's up to the researcher who is doing a narrative review how to form or how to make that narrative review. So it is biased, and it is not like all the literature has not been searched. Like we take help of few articles and then we write a narrative review. So if you have to do a narrative review of a movie, how it is done. So you generally see the review, how much star it is there. So you take the personal opinion of the people regarding the animation of that movie, regarding the storyline, regarding the characteristics, and regarding the comparison. So that's the traditional, narrative review of a movie. So coming to a systematic review, in case of a systematic review, generally it is a very clear-cut, transparent process. So the methods are laid down, and we go through those methods whenever we report those systematic review. So we search for all relevant studies in the database, in the selected database, of course, because we cannot do searching in all database. So we go and we do the searching in selected database, and then we perform our systematic review. We assess once we assess the quality, what are the studies which satisfy the criteria, means not the criteria, at least in the full review, you will see that there are inclusion and exclusion criteria. The way we have learned for the original study, what are the inclusion and exclusion criteria for a person whom we'll take in our original research. Similarly, for systematic review also, you have to see the study, whether it is falling into your inclusion criteria or not. You will assess the quality, and then you perform a systematic review through a structured process, and you provide a comprehensive qualitative synthesis of those full articles which you include finally in your final pool of systematic review process. With this movie, if you see the spider verse, if I have to do a systematic review, then how I will do? So I will again go and take sample from each of the people. Like I'll inquire from the children, I'll inquire from the adult, I'll go and see the review, and again I'll go and see what was the collection in the first day. So it was like I am going to search each and every site, and it is very comprehensive. It is not like I have only gone and talked to a few representative people. So this is regarding the systematic review of this movie. Now coming to meta-analysis, if I have to perform a meta-analysis, what is meta-analysis? So generally we combine, like we have seen, we do the statistical analysis of the studies which are there, the outcome which we have defined. We statistically analyze that outcome, and we see the overall effect size or whatever. Like if it is a proportion, generally you will see that we talk in terms of effect size in case of a systematic review and meta-analysis process, and we say that everything is effect size, like even the proportion, the mean difference, that is like a effect size. So we talk in terms of effect size, and then we quantify how much the overall pool is there. Cumulating the individual studies, what is the overall pool of that particular outcome? So that is the meta-analysis. So in case of this Spider-Man, what will be the meta-analysis? So I'll see the quantitative review. So I'll see the quantitative review over the Rotten Tomatoes, over the Metacritic, over the IMDb rating, and then I may combine these quantitative data, and I may calculate the average rating to show an overall measure of its success. So that is like a meta-analysis in case of this movie review. So I hope you have must have understood regarding those of you who are new to this. Maybe those of you who are already doing it, you know all these. So it may be a repetition for all of you, those who have already done it. So this was regarding the systematic review and meta-analysis. Now there's another, and the narrative review. So we have seen narrative review and we have seen systematic review. Then what is this scoping review? So the scoping review, it lies in between, you can say, systematic review and narrative review. Because in scoping review, we say that the methods are not very, very stringent, and the database search also, that is not, that much extensive. So again, we go through a methodology, and we, map various studies available, and we highlight the gap, and we focus on, basically in case of a scoping review, generally we don't do a meta-analysis. It is more on the exploration, on the evidence which are there, and you will see that many funding agencies, they because it is not that much resource intensive, the scoping review. And in case of a systematic review, you know that you have to get registered in the Prospero. In case of a scoping review, you may, it is not mandatory for you people to get it registered on the Prospero. Although there is an open science framework, you can get this scoping review registered on the open science framework. But again, it is not mandatory. So this is in the scoping review. If you have to do the scoping review of this movie, then how you are going to do? So basically, you go a little more from the narrative review. You see the diversity of the characters which are there in this movie. You see the animations. You see the whether it is limited only to the few characters, or the role is changing through one or the other, everyone. And then again, it explores the multiple trends across the whole entire this superhero genre. So that is again regarding the scoping review of a movie, that is the Spider-Man. So we have seen what is a narrative review. So narrative review is again like a biased, it's more of a biased opinion of a researcher taking few literature reference, and it doesn't follow a very strict guideline. Coming to systematic review, it is a very transparent process where you have to search database, you have to document each and everything at each step, and then so that if anybody else does the same, it is reproducible, and you have to show them you have to give in the supplementary file all the search strategies which you have done. So how this scoping review is different from narrative review? So if you see the narrative review, in narrative review, basically it is a summarization. So whatever is the author's perspective, you summarize your perspective taking help of few of the references. Whereas in scoping review, you have a research question. So you have a research question, and it's more transparent than the narrative review. And then this, if you see this method, so it is a non-systematic method. And in case of this scoping review, it is a systematic, but it is flexible. That is not very strict as you see in case of a systematic review. So the scoping review lies in between the narrative and systematic review. And the outcome in case of a narrative review, it is a general summary you may not cover, because there is no research question in case of a narrative review. But in case of a scoping review, you have got a summary, you have got a research question, so you are going to answer that research question. So you probably it will answer a lot of questions which are there in the literature. So scoping reviews, they are like I said, it lies in between the narrative review and the systematic review. They are more structured and systematic as compared to narrative review, but simultaneously they are more flexible. If you see the systematic review, it is it is not flexible. That means you have to adopt the guidelines which are there. But scoping review, it is more flexible. And if you have to perform a scoping review, you can again, you can see the question impact of probiotics. So question is a little broad in case of a scoping review. So that's the difference between the scoping review and the narrative review. So now there's another review, which is known as the rapid review. So how this review is different from the narrative, scoping, and systematic review. So rapid review, it is generally done, when you have to allocate something, some fund allocation, and it requires less time, probably maybe in a month or so. Because if you see systematic review, it takes approximately 9 months to probably 1.5 years, depending on the topic and the number of studies. In case of a scoping review also, it takes approximately 6 months to 9 months. But in case of a rapid review, it can be done in 4 to 6 weeks. And generally, you get, like of late, we also got one offer of doing a rapid review. The funding agency, they assign this role to you, and they ask for some rapid review of some issue, like neonatal mortality and related factors in Bihar. So they had to allocate some fund on the role of antenatal care and the neonatal health. So they wanted a rapid review of the literature, so that they could allocate some fund on this neonatal health and antenatal care. So generally, it is a requirement, maybe sometimes from the government, and sometimes from the funding agency. For the allocation of resources, they ask for these rapid review. So in case of a rapid review, we compile the evidence. Like in case of this probiotic, if I take the same example of probiotic effectiveness from limited database, so I will just compile, I may compile. So that database, if you see, again, it is not that like you have to, there's no guideline that you have to go through one or two. It is up to you. So time is more important in case of a rapid review. And it provides a quick evidence for the public health decision making. Like I said, many times government or the funding agency, they ask you to do a rapid review. Generally, it is the felt need of the other people. We as a researcher, we never do rapid review. It is the felt need of the organization who may approach you for doing a rapid review on some, some question. We should not call it as a question, because they generally come with a problem. So that some problem they have in front of them, and they want to have a brief overview of that problem from the literature. So they ask for a rapid review. So if you see the rapid review, you just see the audience reactions. You summarize the earlier reviews and a critical reception which is there for that movie, and you provide a quick overview whenever that film get launched. And it usually lacks the comprehensive analysis, and it is usually focused on the immediate feedback. It is not that comprehensive in nature. So it is mostly based on the immediate feedback. So if I have to summarize this, how will I summarize? So first comes the this narrative review. So narrative review is basically, it is a mainly researcher oriented, and it may be full of bias, and it is a broad summary based on the selected literature and the author perspective. Systematic review is again, it passes through all that guideline, and it is very stringent and structured synthesis of or the data, referring to the databases on a particular question, minimizing the biases. And in case of this meta-analysis, it is the statistical combination of those results which are there in our included studies to see a overall summary effect. Scoping review is again, the question is more broad as compared to the narrative, this systematic review, but it has got a question. It is not, generally scoping review is not done without a question, and it again identifies the gap. And rapid review, it is a very faster and simplified version of a systematic review, and the, you can say, scoping review with a reduced scope. Generally, it is not the researcher generated, rather the policy makers and the funders. It is the felt need of those people. So this was regarding, so till now we have talked about the how this original research, what is the comparison and contrasting feature of this systematic review and meta-analysis from the original research. And we have seen regarding the how this, there are various types of reviews. There is a narrative review, there is a scoping review, there's a systematic review, and there is a this rapid review. And how the what is the difference, the basic difference between these review. And then we have, now we will come to the steps of a systematic review. So steps, again, I'm showing you the steps right now, but don't don't get tense and don't get apprehensive seeing these steps, because all these steps will be like, we'll be taking a session on each and every step. So the first step is framing a research question. So we'll take that session first. And then the next step is developing a search strategy. So after we frame a research question, we have to develop a search strategy. And then after we develop the search strategy, then we have to make a protocol. So once all these three steps are over, then you go for the registration in the Prospero. So these three steps are necessary, because some initial search strategies are needed in the protocol also. And you know that there is a Prisma checklist for this systematic review protocol also, and they encourage us to go through that checklist, and you have to develop your protocol taking help of those checklists, and then get that protocol registered in the Prospero. And then after you have done your registration in Prospero, then you run your search strategies in at least 2 databases. You retrieve the citations. We'll see each of these steps. I'm just narrating it right now, but I'll be repeating these many times. And then we develop a system, like we'll be doing it in Rayon. We develop a system for screening the title, abstracts, and the full text. We screen the title and the full and the abstract. We retrieve the full text in the Rayon, and then we have got this forms of risk of bias. You can use any of the forms, but we have used the JBI checklist for the assessment of the risk of bias and extracting data. And then we extract the data. We do the qualitative synthesis. We extract the data, clean and manage the data. And then if if the data is like the studies are homogeneous, and if there is some pool result is coming, then we conduct the meta-analysis. And then we write the result of the systematic review and the meta-analysis, and we publish it. And again, we update it. We write in the Prospero that we have published it. And if new articles are getting added, you may update your own systematic review. Like Priyanka was saying that she has already done 2 reviews. So if she is interested, because it takes time. By the time you finish your systematic review, because generally the process is 1.5 years. Like if the studies, if the team is not that very big, the team is small. So by the time you will finish your systematic review in a year or so, new studies might get added. So what you can do, you can again reinitiate the process of your own topic, which you have already done, and you can update your own systematic review and the meta-analysis. There are people who are doing this continuously, taking one topic and updating the systematic review, like maybe at the end of every gap of every 3 year or 5 year or so. So this was the various steps. Now the first step is initiating a systematic review. Like all of you have registered for this workshop. So like I said, there must be some research question in your mind, or you have heard of this from somewhere, from some of your colleagues, senior or junior, and you have a plan to start a systematic review. That's why you have registered for this workshop. And maybe after you attend this workshop, you may plan to initiate a systematic review process. So, how you will go about it? So, the first and very important step is you have to establish a review team, because making a good team is very essential for a systematic review process. So, how you will make a good team? So, what are the components of that good team? We'll see. The second is in the team, who should be there. So, generally, we say that whenever you form a team, you are there as a lead researcher, and then it depends on the topic. If you are doing something like people who, like there are people who are there in the or from the orthopedic, from biochemistry, from pharmacology, from the critical care medicine, from pediatric surgery, from the you know veterinary, from Ayurveda, from many other streams. So you have to select, whenever you select a research question, you should select your review team based on your research question. Who are the people who are going to give the expert opinion? So in our case, like we did one systematic review and meta-analysis on the effect of air pollution on attention deficit hyperactive disorder. So since we are there from the community medicine background, and this ADHD was there as a psychiatric disorder, so we included one psychiatric faculty in our systematic review team. So depending on the subject or the topic, you may have a subject expert in your team. And again, you since the systematic review process, you know that you can do it even if you are remotely placed. That means people in our institute also, there are people who have got collaboration from outside India, and then they are doing this systematic review and meta-analysis remotely. So because you have to just log in the system and you have to do it, you don't have to meet formally. So even the review team can be formed if somebody is distantly located. The only thing is, like, you should see like-minded people and who are ready to work, because you see in India it is a like culture. No, I should not say culture, because many times you'll see that there are people in the team initially, but now then they don't want to work. Means they just want authorship, or maybe they don't want to work more. So take only those people who are really motivated and who are like they are going to contribute in your reviewing process and in overall this process of systematic review and meta-analysis. The second step is you have to manage the bias and conflict of that review team. So what do I mean by this, managing bias and conflict? Because as a lead researcher, if this systematic review process has been started by you, if there are review team in between, there can be cases like a topic which you have selected. So it may be some topic of the person who has, like, if you have planned this, for example, probiotic and diarrhea, and there is a researcher in your team who has got a lot of work in this probiotic and diarrhea. So you have to like explain this in the manuscript that yes, one person was having a lot of publication, that the way we do in the qualitative research. So biases, you have to commit the see the biases. And again, if I am the lead researcher, so I have got a lot of publication in that area. So generally it is not ethical that I should do a systematic review and meta-analysis in the same topic, because then I'll be biased, because I have done a lot of research on the same topic. So it is the responsibility of a lead researcher to manage the bias and conflict of interest of the review team. The second is because there are stakeholders in your the systematic review process, so you should take help of the holder input also. Like if somebody is funding your systematic review process, systematic review and meta-analysis, so you have to take their opinion, and you should bias their conflict of interest also, because if you get biased by their interest or their motive, again it is your systematic review process is not that transparent, and it will be full of biases. So you have to manage the bias and conflict of interest of those holders also, who are providing the input to your systematic review process. And after you have done these two things, maybe because stakeholder, it may not be possible for everyone, because I don't know regarding the funding status at your end, but if you, even if you are like planning to do a systematic review as an independent researcher, then it is important for you to manage the bias and conflict of the review team. Then stakeholder point, this point which I was talking, this will not be applicable for all of you, this one. this is only applicable for those people who are getting the funding for this systematic review process, or some invitation for the systematic review process. Then comes your this research topic. So what is if you have to formulate after you have done your the systematic review formulation of this team and managing the conflict, then you have got some review question, or even if you don't have, then you start searching for a research question for a systematic review process. So you start with the research question, and then after the initial broad search strategy, you develop the protocol. And after you develop the protocol, you submit that protocol for the peer review. So that is also one, you may or may not. This step is again not mandatory, but you can get a peer review of your protocol also. Then your search strategy or your research questions, they will be refined. And then you make that protocol publicly available, and you can get your protocol published also. And in this, again, after this, you have to register that in the Prospero. So these are the initial steps which you have to do before you go formally into a process of the systematic review. So now coming to the first step. So first two steps, like, so what all of you will do once you like after attending this workshop, you should select one or two, and even if you see the minimum number, many time people have asked like what should be the minimum number of people. So it can be done for with the help of two people in the team also. So I think Dr. Raymond has asked what is umbrella review. So umbrella review is again if you combine the multiple systematic review in a particular topic, then it is known as the umbrella review. So combining multiple systematic review is known as the umbrella review. And again, Dr. Priyanka has asked, under which heading can we ask for funding? So funding is generally I don't know, ask, generally they approach, or many times they float some interest from their end, research proposal from their end. Otherwise, generally in our case, the funding agency, they has approached us for doing a systematic review. Otherwise, in India, I don't. Maybe ICMR, they also fund this systematic review. They have formulated one hub or Cochrane something. It's not. Is it the name of Cochrane? Some there are other names. Something like Cochrane in the ICMR. So they have started that training process, and they have taken people from the Bihar also. So I think they have taken some state-wise, some selected people in that particular community, you can say, who can do the systematic review, and they have got some funding this thing. So that is there. And in case of this thing, this umbrella review, again, like Dr. Raymond, it is, like I said, it is the combination of multiple systematic review, and they don't conduct their own meta-analysis. So that's the umbrella review. And do we need any approval from the ethics committee? So again, generally, the ethical committee clearance is not needed in case of a systematic review. But again, in our case, generally, our IC requires that we should intimate them. So clearance is not needed, but intimation you can send that you are going to start a systematic, you can just mail them. But ultimately, that presentation and all that stringent IC and IRC clearance, that is not needed in case of a systematic review and meta-analysis process, because you usually do on the published literature. The IC clearance is generally for the study on human being. Ethical aspect. So that ethical aspect you see, but since you are not doing anything on human being, whatever is there in the public domain, you are using that. But yes, you should intimate your IC regarding your team, because if you are working in an organization and if you are working with people who are like, in a team manner, so it's a kind of collaboration only. So what we generally we do, we write a mail to them that we are going to start a systematic review process, and these are the team members. So that's it. Intimation is definitely required, but clearance is not required. Approval, you can say it's not required. So now coming to the formulation of topics. So if you see the research, after we have decided that we are going to do a systematic review. So next question, which is a very difficult question, and rather I should say it is the most difficult question to find a research question. Means topic. On what topic you should do. And that is there in case of original research also. So I think you all are at the level where, you know, you are at the level of supervisor. Many of you are professors and head of the department, a lot of many years of experience. So finding a good research question, that's really challenging. And you have to spend a lot. And many times what happens that student has come and then what do you want to say? Okay, we can. How much experience? Okay, have they formed? Okay, so Dr. Shamshad is saying, we are floating a Zoom poll. So probably kindly answer that regarding the research question. Okay. So you will get a prompt at your end and you have to answer that. So the question is, what is the effect of probiotic supplementation on duration of acute diarrhea in under 5 children? So you have to answer whether it is a good research question or not good, not so good. We should not say bad, but we can say not so good. Are you seeing it? Okay. So maybe those of you who know regarding PICOT a little bit, although I have not talked about that. So there are 5 questions. The second is, does daily intake influence overall health and well-being in adults? Dietary intake, sorry. Then third is, among adults with hypertension, does aerobic exercise compared to no exercise reduces systolic blood pressure? What are the effects of intermittent fasting on metabolic parameters in overall overweight adults? And fifth is, does consuming yogurt regularly improve overall health outcome in children? So these are some research questions, and so we'll see the components and then we'll see whether the criteria. Once I think how many of them answered? 23, 24, it is increasing.
Just baseline assessment for me, like what is the level, then we will start. It be logical assessment about it. Just
So we are ending the poll, and probably we will again flash this once we learn the components of a good research question. Answer, will they be getting an answer? Share the result. So in the first question, it was a correct answer was good. If you see the second question, does daily dietary influence? Okay, so does daily dietary influence overall affect the overall well-being in adults? So the correct answer is not good. And I think most of you have answered, 64% have answered not good. If I come to the third question, among adults with hypertension, does aerobic exercise compared to no exercise reduce systolic blood pressure? So answer is good, and I think 88% of you have answered correctly. The fourth question is, what are the effects of intermittent fasting on metabolic parameters in overweight? Again, 68% have answered good, and the correct answer is good also. And does consuming yogurt regularly improve overall health outcome? So again, not so good, because what is overall health outcome? So you know, I think majority of you have answered it correctly. So now coming to how to find a appropriate or a good research or a review question. So the first approach. So there are various approaches, right? Like how we are planning. Again, like we did one systematic review and we are planning to start another review and we are searching the topic. So how we will search the topic? The first thing is you have to, the way we do for original research, identify some gaps in the existing literature. So you can review some existing systematic review processes, systematic review, and you can see like what where they have missed, or maybe you can look at their conclusion and limitation, because in each systematic review they also write that what was the limitation in their case. So you can look up specially to their conclusion and their limitation, and you can try finding out something from their conclusion. So like this was one systematic review on the effect of metformin on polycystic ovarian syndrome in overweight women. So they did a systematic review and meta-analysis of randomized control. So it was a systematic review and meta-analysis on intervention studies. So they have written that from the current research status, the therapeutic effect of metformin on PCOS patients is still controversial. And they are saying that, in the overweight women, it was not there. So in this study, that's why they have took this overweight women, this effect of metformin. But in their conclusion, they have written like more RCT. Here also, if you see this part, if I focus on this part, so they have said that, future studies are needed to, let me see this black. Yes. So if you see this, they are saying that in future, further attention should be paid on the effect of metformin doses and intervention time in overweight. So maybe the systematic review which they have done, they have not emphasized more on the doses and on the intervention time, when it has been given for how long. So those things, if you want to take the same topic, you can address in your systematic review. Or maybe if you have to see like in this case, again, more RCT with a rigorous research design are needed to determine the efficacy of metformin in treating PCOS patients and in non-overweight. So maybe, and to apply metformin in interventions for non-overweight. So maybe you can take some other population. So they have done in overweight, you can take some other population. So from the existing systematic review, if you read their limitations and conclusion, you can find out the research question. So that was the first gap. Finding out the gap in the existing literature. So how you will find the gap? So Cochrane is the largest evidence-making body for this systematic review. So you can use the database of Cochrane, or you can see the PubMed or any other access to the library which you have. And then you can see the recent reviews, last 2 year or last 3 year, which is the topic which is of interest currently. And then you can look at the conclusion and limitations, and you can form your own systematic review topic, the research question. That is the first step. So this is like Cochrane, the interface of Cochrane. You can go today and you can just start searching. These are the various topics you can see. There's a various like people who are there from the orthopedic or from the neonatal, like pediatric surgery or neonatal care, or some, any, like one person was there from the urology. So you can see the various particular branch of this health topic, and you can try searching the various systematic review and meta-analysis process. So like many of us are from the community medicine, so we can see the public health topics. And from public health, you can see what is the area of your interest. So maybe is it the NCD, or maybe the maternal and child health. And there are others also here related to the public health topics. So you can see the Cochrane, or you can see the PubMed also. Let's say I just don't want to see the Cochrane. So I can directly put the systematic review in maternal and child health. Like I said that we had to do a scoping review on effect of antenatal care on the neonatal health, the birth weight and the immediate neonatal health in the early neonatal period. So that gap, how have we formed the research question? So we have specifically seen the systematic review on this topic, the antenatal care and the neonatal effect of antenatal care on the neonatal health. So, and then you can, after that, you form a broad topic, then you can refine your question. So first is to identify a topic. Then comes the formulation of RQ, and then the refinement of that RQ. So this is regarding the how you can, and you can see like duration also, whether you want to see the publication date. If you see in the last 1 year or last 2 year, you can here you can show that I mean the dates also. You can give them the dates like how many like last 5 years or 2 years, how you want to search. So you can see on the Cochrane, or you can start seeing the new research. So once you log in into the Cochrane, they show you the new research, what is going on. Then you can go through that and you can find your own research question. Like this was one topic on this Cochrane Library, that was a school-based physical activity programs for promoting physical activity and fitness in children and adolescents in 6 to 18 years. And they have, in their limitations, they have written that one limitation of this update, that we explode impact only at the immediate post-intervention time period due to the wide heterogeneity in follow-up time across intervention. So you can see if by the time if you are interested in that topic, if you can resolve this issue, then you can do that. Or many times what you do of late, what we are seeing, that people are now localizing the study. That means like, I just want to take studies which are published in India. So maybe the population, I am just, narrowing it down. Maybe only Southeast Asian. So in your, just to start with, if you don't want that big database to search, I mean that big number of articles to come into your screening, then you can start doing a meta-analysis, systematic review and meta-analysis on a specific regional basis. Like I have seen here in our institute also, maybe in the this thing gastro department and many other department, they have conducted meta-analysis. Like there was one faculty who did only on the prevalence of tuberculosis in case of a intestinal disorder in Indian setup, because TB is more common in India. So specifically, you can also form a topic if it is a felt need. And again, we know that these days there are various, so patient is also a stakeholder in this evidence-based medicine. So taking their input also, you can form a research question. Second approach is to formulate a research question from the clinical or practical problem. So every day you are deciding something, you are thinking facing some issue, maybe regarding the dose, or one versus or the other way of doing a surgery, or there can be many questions which you are facing on day-to-day issue, and there is a like uncertainty of evidence in the literature. One RCT is saying this, the other RCT is saying something else, and you are not sure what to adopt. So in that case also, you can start a systematic review process. For example, you will see that many times, even for a simple common cough and cold, antibiotics are being prescribed by the viral infections by the GPs, by the general practitioners. So there are guidelines, and you will see that that's why there's a lot of antimicrobial resistance which is developing. Maybe the reason is like there is a diagnostic uncertainty, and many times the patients are also expecting from the doctor that if they have gone to the doctor, and they should get something. If they don't prescribe antibiotic, they might take the self medication, or if there is no some definitive diagnostic tool is there. So what should be the algorithm based on which I will prescribe the antibiotic? So if I may want to do a systematic review taking this clinical decision support tool. So I just want to see, is this clinical decision support tool is effective in reducing the antibiotic prescription for viral respiratory infections or not? So that may be a clinically driven question, which I might think of doing a systematic review. So here, because there is a debate, in the clinical practice over unnecessary antibiotic use, despite the recommendations, we are seeing that in real world practice it's happening and people are giving. So in case of such debate, again, you can perform a systematic review. And traditionally, if you see the history of this systematic review and meta-analysis, so in 2012 also, there were before that a lot of people were going for this annual health checkup. So in many companies you will see that they go for this annual health checkup, but they have seen by the systematic review and meta-analysis that this is not a very good practice. Rather, you are subjecting the person to unnecessary tests and unnecessary stress also. that doesn't add much to it, and that has come into the systematic review and meta-analysis process. So many times you will see that we are doing something, we don't know exactly why we are doing, because someone has said it, maybe because our parents, probably our neighbors, has said that this is good, so that's why we have started doing something. So in that case, again, you can form a research question. So the review question based on this gap will be, if I use this PICOTS, so the population can be the viral respiratory people suffering from the viral respiratory infections. So in adults presenting with viral respiratory infections, do clinical decision support tools compared to usual care without decision support tool reduce the risk of inappropriate antibiotic prescription. So the outcome here is the reduction in the rate of inappropriate antibiotic prescription. The comparison group is the usual care without this decision support tool, and the intervention is this clinical decision support tool, and the patients are the adults presenting with the viral infections. So the another approach could be, you can engage with the practitioners or the expert. So maybe, like I said, there are people from the clinical specialty and you are there from the public health or from the community medicine. Again, you can form many of your friends who are there in some other department. You can form a team and start thinking of some questions which maybe as a researcher you are not able to think. So you can talk to them if they are facing some issue or some debate or some diagnostic dilemma, then you can do a systematic research, try to search a question. So like in this case, this was one problem which was identified, like after consulting the physiotherapist and pain specialist, it has become very clear that while exercise, generally we recommend exercise for backache, but we don't know what should be the duration of that exercise and what should be the type of exercise which will prevent these backache. And there's no clear consensus whether strengthening exercise should be done or stretching exercise should be done for the long term relief and improvement. So the debate is if you see the practitioners, they are again facing a real world challenge and they want to identify the gap in the treatment approach. So the question which they have identified, in adults with chronic lower back pain, which is the population, do strengthening exercise, which is the intervention, compared to stretching exercise, which is the current practice, lead to greater improvement in the pain reductions and reduction in the functional mobility. That is the outcome. So this may be one research question based on the gap which the physician or the physiotherapist they have felt. So again, the third approach can be using the PICOT framework. So what is this PICOT framework? So we know that PICOT is where the P stands for population. So you can start doing, like many times, like I just say that, I'm more interested in antenatal women, or maybe if my interest is in maternal and child health, or if somebody is pediatrician or pediatric surgery, or so maybe your interest is on children. So you can start with the population and then you can see what interventions. So what interventions, if you are doing it on an everyday basis, so maybe you may start with a population in whom you are interested, and then you can try finding out these I, C, and O, and then we can use this PICOT framework to identify a systematic review question. But again, this we identify, if you see the strategy, we identify it on the basis of literature search only, because randomly it cannot come to our mind what should be the intervention. Again, it may come either from our own experience, from own diagnostic or decision making dilemma, talking to friends, talking to patients. Many times patients will guide you, like a particular, if you see many times a particular surgical technique, they just don't want to go for open surgery, although if it is they will always say that it should be laparoscopic. So then you can see like evidence, although I'm just telling you all the evidence has been generated, but many times the patients lead you and they also help you in forming a research questions. So this you can think of about population which you encounter, like ease of this thing also you see, like in case if you are doing something on asthma, then again you see the children who are suffering from asthma, you want to do something on asthma. So you start with the particular topic of interest, and then you can try searching the research question in that particular population. Intervention, again you can see like specifically that are emerging in case of asthma, which are the treatment modality which are emerging, and then you may suspect that the treatment which is emerging, is there any uncertainties existing about those treatment or not, and that can be a lifestyle change or any other intervention that is upcoming. So starting from a population, you can see upcoming interventions, and again you can see the diagnostic, the uncertainty level in those interventions. Then you can try selecting a comparison group. So comparison group can be a placebo, it can be of no treatment, or it can be a standard treatment, although these days generally we don't go for a placebo and no treatment. But again, since you are doing it on a published study, so you may find a different comparison group. So like if you are doing this study on the effect of probiotic on childhood diarrhea, then this comparison group can be a placebo, it can be a medication, or it can be a lifestyle change. Now coming about the outcome. So outcome is important because ultimately this outcome, you are going to present the result of your meta-analysis on this outcome. So outcome, what it can be, like I said, it can be a patient-centered outcome also, and you have to consider the outcome which the population or the patient is considering the important, or outcome which will affect the clinical decision making, like mortality, like relief of the symptoms, like improvement in quality of life, or if it is a tumor, then the recurrence rate or something regarding this cancer or a tumor. So outcome you should consider which is meaningful to the patients, to the community, to the decision makers, to the policy makers, so that your review, because ultimately you are making so much of effort in doing this systematic review, it is going to take almost 18 months, 9 months to 18 months. So selection of the topics should be such that it should be of help to the scientific community or the patients or the decision makers. So if you are brainstorming purely on the basis of your own understanding, then it is difficult that such research question will come. But again, you can start from a population. I said like childhood. If my population is, if I want to do something in childhood obesity, and I'm thinking that yes, it is a major public health problem. Maybe my own kids are obese, and then I may think I'm doing some interventions and I'm seeing that nothing is working. So I may see that is dietary interventions are really helpful or not, or maybe there are many types of diet like low carbohydrate diet or high protein diet. So are they working or not? And then I may see the comparison group, like one type of diet versus the other type of diet, and I may see that whether there is a reduction in the long term weight or the weight loss or not. So the what review question I can form, like in the children with obesity, which is my population, does a Mediterranean diet, which is my intervention, compared to a standard or a low fat diet, lead to a greater weight loss or long term maintenance or not? Okay, so 5 minute break, somebody has said.
Okay.
Okay. Okay, so I think we are taking a break of 5 minutes, and then we again will meet at 11. What is the time? So I was talking regarding the research question and how we can start searching for a research question. So if you see, we always say this, that this sentence has been, we have taken this sentence from the Cochrane, and there the author has said that the far better an approximate answer to the right question, which is often vague, than an exact answer to a wrong question, which can always be made precise. So that shows the importance of a good research question, that if you have got a good research question, even if the answers are bad right now, the answers might get refined in future. But if you get a very good answer of a wrongly framed research question, then it is not a good strategy. Because why we say this? Because we think in case of a systematic review, we always say that we compare orange with orange, not orange with apple. We should. So in case this systematic review, even if studies which you have selected that might look similar to you, but that may differ in case of a patient population. Like for this diarrhea, this can be, the population can be very wide. It can be 0 to 5 years up till 15 year. The diarrhea can be there in adults also. There are various inclusion and exclusion criteria which you have set, but all the studies, some studies have taken some inclusion criteria and some studies have taken some other exclusion or inclusion criteria. The definition of exposure, it is again, or the intervention, because in PICO or PICOT, the E stands for exposure and I stands for intervention. So there can be differences these or in this exposure or intervention definition. Like in case of a probiotic, it the level of that lactobacillus dose, there can be different dosing of these lactobacillus, or the symbiotic, there can be difference in dosing, there can be difference in composition, there can be difference in timing. In one case it may have been started within 24 hours, in some cases after 3 days. So the timing of intervention is also important. When have we administered the intervention? So even if the study looks similar, but the study may differ in these contexts. In case of comparison group, one study has used a placebo or a standard treatment. Some other studies has used two types of these lactobacillus or two types of this probiotic. So control group are also differing. It is not always placebo or ORS. So again, there can be differences in the comparison or control group, and there can be differences in the management protocol also. Like in one case, you may find that along with this probiotic, injectable antibiotics are also being given because there are some other associated conditions also, or ORS and probiotic, some other probiotic or some other interventions are also being given. So management protocol might differ across those studies. The definition of outcome also might differ. Why? Because you will see the exercise which we will do in these 3 days time, that the follow-up time can also be different. Like when you are deciding that you will take the outcome, whether it is at the end of 3 days of probiotic or 4 days of probiotic or 7 days or 1 week or after 24 hours or so. So whatever is the like time it is there, how much time, follow-up time you are taking as inclusion criteria, because then the studies you will find that they are quite heterogeneous in case of this follow-up timing also. And then there can be differences in the reasons for the mortality if it is there, if some other study is there. And then the quality of the design and the execution can also be different. Why? Because there can be one study where there are no biases, and then can be another study where the randomization has not been done properly, the allocation concealment has not been done properly. So the type of study design and execution of that particular study design is also very different across each study. And again, the analysis. Somebody has taken some other analysis, analytical type. Someone has done some, like there are a wide variety of analytical technique, and you can find the heterogeneity in all these studies, taking all these criteria into account. So you may think that, all the studies which has come, you have screened the title, abstract, screening and all, but again, the studies might differ in all these contexts. Now, all of you please read these two research questions, and you please type your opinion around the broad or a narrow research question. So the first question is, what is the effect of probiotic on gastrointestinal health in children? This is the first research question. And the second research question is, what is the effect of Lactobacillus rhamnosus, GG, on reducing the duration of acute diarrhea in children under the age of 5? So please type your comment. Which is the broad and which is the narrow? Dr. Tandra is writing one is broad and two is narrow. Yes. Dr. Beneath is writing Farzana. Second is narrow and ideal. One is broad. Bhavna, one is broad. Seva Sarvashri, one broad, two narrow. Very true. Right. All of you are right. First research question is a very broad research question because you are saying that, effect of probiotic on gastrointestinal health. So this gastrointestinal health is very broad. And again, if you see the second, the strain is very specific and the duration is again, the outcome is very specific. So now there are some issues with these broad and narrow question. So there are issues with the two broad questions also, and there are issues with the two narrow questions also. Now, we are giving you a Zoom poll, and you have to answer these 5 questions regarding the whether these research questions are broad or not or narrow. Only 2 options. So you can see the first question: what are the effects of exercise on cardiovascular health? So is this question broad or narrow? Second question is, does 30 minutes of moderate intensity jogging reduce systolic blood pressure in aged 40 to 50? Broad or narrow? Third question, how do antibiotics affect bacterial infections? Fourth question, what is the effect of azithromycin on throat pain relief in patients with group A streptococcal pharyngitis within 48 hours of treatment initiation? And fifth is, does Lactobacillus rhamnosus GG reduce the diarrhea duration? Age 6 to 12 in children aged 6 to 12 months with rotavirus infections in urban India. So if I see the answers, so starting from the first question, first is what are the effect of exercise on cardiovascular health? So it is a very broad question because if you see the interventions and if you see the outcome, it is very broad. So I think all of you have answered correctly. Second question was, does 30 minutes of moderate intensity jogging reduce systolic blood pressure in hypertensive adults? This is again a narrow question and all of you have answered it correctly. The third question is, how do antibiotics affect bacterial infection? Again, most of you have answered it correctly. It is a broad research question. Fourth is, what is the effect of azithromycin on throat pain relief in patients with group A streptococcal pharyngitis within 48 hours of treatment initiation? The correct answer is narrow and all of you have answered correctly. And the fifth question is, does Lactobacillus rhamnosus GG reduce the diarrhea duration in children aged 6 to 12 months with rotavirus infection? So this is the narrow question and all of you have answered correctly. So this concept, regarding the broad and narrow research question. So now what are the disadvantage of a very broad questions? So if you have got a very broad question and if you put it, there will be a lot of inclusion and exclusion criteria. Inclusion will be more because how you will define the gastrointestinal health, then everything will come into this gastrointestinal health, and you will have a lot of studies, like it will be in lakhs, the study will be in lakhs, and it will be difficult for you to manage that systematic review. And again, it is not going to answer anything. That means the body of evidence for which you are doing this research, that it should contribute something to the scientific community, to the policy makers or to the patients, then it is not going to add. So that's the disadvantage of broad question. But if you identify a very narrow question, then what can be disadvantage? The first thing is, if the question is very narrow, then you will not get many articles, because if it is something a very particular strain and if you are defining outcome so strictly in 6 to 12 months of age group of children and then on third day of diarrhea, So if you define something so precisely, then probably you will not get many studies. The number of studies will be very less. So then the pool result which you get, that may not be amalgamation of many systematic reviews or many original articles. So the study or the citations which you get, that might be very low. So that's why we say that it should be a balance. So your research question should be a balance. It should be midway between a too narrow and a too broad question. Neither it should be too broad nor it should be too narrow, because we know that narrow question will have a limited number of citations and studies, and a very broad question, again, it is not going to add to the scientific community, and the number of studies also, it will be so huge that it will be impossible for you to manage that. So a balanced question can be like, what is the effect of probiotic interventions on the mean duration of diarrhea and related outcome? Probably one outcome I have mentioned, but I may want to see the hospital stay of children, or maybe the status of dehydration in the children. Because if I'm spending that much time in literature search, it's advisable that I should have at least one or two or three outcome, so that then you can show the pool result of these three outcome. So that's why the balanced research question should be midway between a narrow research question and a broad research question. So what are the stages of framing a research question? So first stage is you have to define your research question. Define means you have to identify in terms of PICOT, and then after you have identified a broad PICOT, then you refine your research question. So we will see these two steps. What is the defining and what is the refining? And one more thing is like this before you make your protocol, you define your research question. And once you submit your protocol for the Prospero, because this refining the RQ also involves a lot of literature search. So if you want to start the process of registration, and if you don't want to do an extensive literature search for refining your research question, then you may go ahead with initial definition of your RQ before protocol submission, and then you get your protocol registered for the PICOT. And then once you in the Prospero, and once you get your this protocol registered in Prospero, then you can move ahead with refining your RQs. We'll see what is the definition of this defining RQ and refining RQ. So first thing is when you have to define the RQ, first thing you have to select the population. So very broadly, like you will say, because you have to work on the existing literature. So for refining your RQ, you should see each and every many articles to see, is there any availability of those particular patients or the population or not. So like patient population, you can think of doing this only up till 5 years of age, because it's children. Or if you define children up till, let's say, 15 years, or maybe till the adolescent, 10 years, then you can say that, my population will be children up till 10 years. In intervention also, you just start with very broad, like you see what are the probiotic supplement, like lactobacillus, there is a Saccharomyces, there is a bifidobacterium. So all these probiotic supplements are there. And then you see the comparison group. So in comparison group, again, you may have a comparison group of a placebo or a ORS or a standard treatment. And then you see regarding the intervention. And then outcome, again, you may see it as a like maybe reduction of duration of diarrhea, or maybe the frequency of diarrhea, or the hospital stay. So, and then you form a research question, like in children under 5-year-old, does probiotic supplementation compared to placebo reduce the duration of diarrhea? This is my initial RQ. And then I will define my RQ. That means the population component is, I will again elaborate on this. So I may say that who are the population in my case? So are there only suffering from diarrhea? So I have to mention the explicit diagnostic criteria. How I will define diarrhea? Because for every disease condition, there is a definition. So will I take WHO definition, or will I take CDC definition, or IAP definition, or any other definition? So maybe I can say that I will take, and I'm going to, will I take the children less than 1 year or only 1 to 5 year? So I may further refine it, like children 1 to 5 year old, 1 to 5 year with acute diarrhea, diagnosed by using the WHO diagnostic criteria, that at least 3 liquid stool within 24 hours. So that is my definition. Like for air pollution, we did this, our initial first, this systematic review on uh, ambient air pollution and the effect on the ADHD on children. So, but again, we later realized, because once you submit it in Prospero, they don't we did not get our protocol peer reviewed. We only drafted the protocol and we got that protocol registered. But when we started searching for the studies later on, we found out our mistake, that our question was very broad. Because if you write the effect of ambient air, outdoor ambient air pollution, outdoor air pollution, so the our outdoor air
और
pollution
मेरे को बोलो
got
खिड़की नीचे
many
करो।
component.
हाँ, आदमी आ रहा है पेंटिंग लेके, ये और फिर वापस आएगा, उसको आने देना हुआ।
So, like I was talking regarding initially when we have framed our research question, that was a very broad research question. And that's why our process it got delayed, because there were many articles. And how, because if you see the air pollution, there is a gaseous air pollution, there is organic solvent air pollution, and then there's a particulate, like there's a PM 2.5, PM 10, NO2, there was a sulfur dioxide, there was benzene derivatives, there was ammonia. So number of air pollutants were so huge, and the studies were so heterogeneous in nature. So it was very difficult for us to manage. So how we should define? Then we again went to Prospero and we defined. So why I am narrating this? Because even if you get your protocol registered in Prospero, you can later do some changes in that protocol. That now you define this like this, or you are restricting your outcome, that is the ADHD, only to clinically diagnosed ADHD, or the population or the air pollutant only to WHO definition of air pollutant. So we have then modified the protocol, that we are not going to take the organic air pollutant. We will only take the gaseous one, and these air pollutants we'll take. Again, regarding the population, so we have initially we did not commit that are we going to take the prenatal period or not. That means when the baby is inside the uterus, that means are we going to take intranatal period of the baby or not, that exposure, because it's a exposure. So exposure duration, how we are going to define. So then we later refined the protocol, that we are not going to take the antenatal period. We will take the exposure after the childbirth, and then we will see the effect of this air pollutant on the ADHD development. So these are the few issues when you define a research question. So again, but there is the beauty of this Prospero is, even if you register it initially, because initially you are not very sure. You just make a question. It's not very much refined. You submit it, but later on, when you start doing the review process, you can edit it. So that's flexibility is there. So coming to intervention, if you see this, the intervention component in PICOT framework, if you see the exposure or the intervention, you can see the timing of exposure. What was the route of administration? Generally, probiotic, it is given orally. But was there any other route of administration? Was the dose was same in all the studies, or what was the range of dose, or the duration of exposure? Was it given for 1 week, or 3 days, or 14 days? In what form? So these are the interventions, that the further refinement of your interventions. And then you see, if you see in the related to this probiotic and diarrhea, So regarding the timing, you have to see like what all criteria you are taking. So are you taking it only if it is administered within 24 hours of diarrhea onset, or you are taking any time? And you are taking only oral route in sachet form, or you are taking any other route also. Dose, how much you are taking, and duration, like at least 5 consecutive days should be there, or until diarrhea resolves. So these refinement should be there of your research question. And then again, for comparison, also you define that whether you are going to take placebo or standard treatment or any other probiotics also. Or you see like comparison in that, then you can find like you are taking the comparison. If you see in the example of this probiotic and diarrhea, then you can write like placebo you may take who has taken either a vitamin pill, or standard therapy you can also take like ORS in if it is given in the both group. Now, you have to see, laid down a clear-cut criteria for defining the outcome, and it should be predefined. So, how you take the criteria? So, it should be beneficial to the consumers and providers, and you see the unpublished data also. So, you see, and you see the published meta-analysis systematic reviews also, and you take the help of those published literature also in defining the criteria for the outcome. So like in case of a probiotic and diarrhea, the defined outcome could be like reduction in the frequency and duration of diarrhea. And like parents may be concerned because it is important for the consumer, because I said that all these evidence-based medicine, we take the perspective of patients also. So this duration of diarrhea is important because parents may be concerned with the quicker recovery of the children and the clinical data. If you see the unpublished data, so we will talk about this gray literature. So we take the help of this unpublished data also, where the clinical trial data on the probiotics, it is not published, but it is available in some other form. So now on the basis of this, now I will refine my question. So how I will define my question? So first thing, I will define the participants. So who will be my participants? So then I'll write like, yes, I will have a clear diagnostic criteria, because these inclusion and exclusion criteria in PICOT, it will help once you like start importing the study in Rayan, and there are 3-4 team members who are working simultaneously in the title and abstract screening, or even if 2 people are working, then everybody will refer to that criteria, and then it will be a clear transparent process. Otherwise, one study, if you say I will include it, the other reviewer will say no, I will not include it. So that happens when your clear cut these PICOTs and in exclusion and in exclusion criteria are not defined. So here you will write like how the disease or the condition was defined. So like you may write like clearly again that WHO definition of diarrhea, and what are the most important characteristics that describe these participants. So are you going to take the kids who are having comorbidity also, like it should be either only watery diarrhea, or if there is a dysentery, then are you going to take the baby or all that baby or not? Or if the baby is with some other pre-existing disorder, like some immunocompromised disorder, then are you going to take that child or not? Or any other relevant demographic factor. So are you going to take a particular race or a particular regional differences, like, so these factors you have to mention. Or what is the setting of that particular cases? So are you going to take only hospital based cases, or the private cases, or the private nursing home, or the community based, or if it is a primary health care, so only tertiary care centers or the primary health care centers? So these setting you have to define. And then who should make the diagnosis? Like in case of a ADHD, we have written it in the protocol that diagnosis, it should be the teacher reported, or it should be the clinician reported, or it should be the parent reported, all three reported. So if even if the parent are saying and later it was confirmed by the clinician or by the teacher, then again we will take that, because in many studies you will see that varies various sort of diagnostic criteria are there, and they have defined the ADHD like that. So who has made that diagnosis, whether it is clinician or some general practitioners or some confirmed by some other expert. So that you have to define in case of a patient or the population which you are taking. Or again, like I said, any other disorder which the person is suffering, like any immunodeficiencies, the person, if the child is suffering from tuberculosis and HIV, and if he's suffering from diarrhea, are you going to take those cases or not? Or if the studies only no involve, like if the children, if they're suffering from chronic diarrhea or if they're suffering from dysentery, are you going to take those studies or not, where the study has been done on the dysentery or on the chronic diarrhea? So then you have to define, no, I have to, those will be your exclusion criteria. So you will write in your exclusion criteria that children who are suffering from immunodeficiencies or HIV or TB or any comorbid condition, or suffering from chronic diarrhea or undiagnosed or some long duration diarrhea, then you are not going to take. So that is the refining of your question. So each and every specific thing, but how will you know these things? So for that also you have to see the literature. So what are the studies? So once you start doing the, after making the protocol, a lot of refinement occurs during the initial, when you see the literature search is again needed. It's not only for the inclusion in the final study, but for refinement of your research question also. And in between also, you talk to your teammates. We'll see in the Rayan, something you have not thought of earlier. And while doing the title abstract screening also, there can be some decision dilemma regarding whether to include or exclude that study. So you can refine this even at the level of title abstract screening. Coming to the participant again, like children under if you see the same example, children under 5 years old diagnosed with acute diarrhea in community setting, this I can refine my question and I can write like exclusion, like children with underlying immunodeficiency or diagnosis confirmed by a healthcare professional. So this I have just refined my population for a consistency across all the studies. So in refining my RQ, generally I have to take care of these 5 elements of this outcome, because outcome is very important. On the basis of this outcome, you are going to perform meta-analysis, because it should be measurable. That's what we say in PICOTS, that outcome should be measurable. So unless you have some defined criteria for this measurement, and the measuring this outcome, it will be difficult for you to perform meta-analysis. So first thing, you see the domain of this outcome. So what is the domain of this outcome? Like in this case, probiotic and diarrhea, I say that it should be the diarrhea severity or the gastrointestinal health. So that is the domain of the outcome. Then next is your specific measurement. So what tool I am going to use? So in that case, it may be a clinician who has diagnosed, that I may consider it as a gold standard, or I have considered the stool frequency count or the Bristol stool scale. Any scale I am using, like for ADHD, we have used Conners scale, and there were 3-4 scales. There was a DSM-4 criteria, DSM-5 criteria. So we have laid down that what all outcome we'll take. So only outcome which has been measured either by the Conners scale or the this DSM-4 or 5 scale, or there were 4-5 scales which we found out during our literature search. So we said that we will include only those studies which has used these scales for the diagnosis of ADHD. Because outcome, if it is not a very objectively measured, then the pool estimate which you will show, that will be not very much of high fidelity and high evidence. So that's why it should be clearly mentioned what specific measurement. Again, it is this you have to mention in your protocol and in your inclusion exclusion criteria and PICOTS also. And you have to write like specific metrics. Metrics means how you are going to measure. So like, are you going to measure the reduction in stool frequency? Like in this case, you will see that we have taken 2 measurements, that is the reduction in the proportion of the children who are suffering from diarrhea, or maybe the duration, less than 4 days or more than 4 days of diarrhea, or maybe the change in the duration of diarrhea. You can take it as a length of hospital stay. Maybe if with the probiotic, the hospital stay was less, and without probiotic, the hospital stay was more. So specific matrix, I may write like it is the duration of hospital stay or reduction of, so I'm going to measure the reduction of hospital stay from the baseline. So the baseline means no treatment versus placebo. So I have to see whether there is any reduction in the hospital stay or not. And then the fourth will be the measure of aggregation, means what outcome method of aggregation I'm going to use. So I'm going to use whether I'm going to use odds ratio, I'm going to use proportion, or I'm going to use mean. So that's how you will see the option. You will see the meta-analysis on proportion, meta-analysis on relative risk, on odds ratio, on hazard ratio, on mean difference. So there are various these measure of aggregation, and you have to specify that are you going to do a meta-analysis on odds ratio, taking it as an outcome, or on the mean or on the proportion. So outcome, this is important. And next is your time point. So which outcome you are taking? Like, are you taking the outcome after 24 hours, after 3 days, after 7 days, 14 days, or you are going to take 3, 4 time points. You are going to take at 24 hours. Then you have to perform meta-analysis for separately, for 24 hours separately, for 3 days, and for 7 days. So many times they suggest, Cochrane, that you should add like T and S also. In PICOT, this T specifies the timing. So that we have just learned the length of follow-up. So if the trial is studying a probiotic on diarrhea, then the researcher, you may assess the outcome at 7 days or on 14 days. So which timing, minimum duration of timing, especially in case of intervention trial, which minimum number of days you should take to as a follow-up days. And then in setting again, like we have discussed, the background setting means it is whether a less developed country, or whether it is if you take the country wise, or if you take the specific setting, was it the primary healthcare center or a tertiary hospital or specific pediatric hospital, or you are taking inpatients, clinic or inpatient setting. So like again, you can, for probiotics and diarrhea, you can focus on the hospitalized pediatric patients, or you can focus on only OPD. You are not going to take the inpatients. You are only focusing, or a particular diarrhea unit you are only going to take. So these settings you have to mention which setting you can take. And again, if there are multiple settings, in that case, you have to assess regarding the homogeneity. If it is a homogeneous, then you can perform a meta-analysis. If heterogeneous, then you can try sorting out the homogeneous study and perform separate meta-analysis. That we'll see when we'll see the meta-analysis. Some example, like in the previous workshops, people were asking regarding the anatomy, like some research questions from the anatomy. So we looked up into the literature. So this was some basic, like what are the variations in the branching pattern of the brachial plexus in human cadavers, because how these variations will affect the circle of Willis in the cerebral blood flow and strokes risk. So these two, some can be basic and some can be clinical in case of a anatomy. For biochemistry, like some basic research question could be like what are the structural and functional differences between isozymes of lactate hydrogenases? And a clinical applied one, you can form a research questions like how do serum lipid peroxidation markers correlate with the oxidative stress and metabolic syndrome? Again, for physiology, like what is the role of stretch receptor? This can be one basic question. What is the role of stretch receptors in lung expansion during the Herring-Broer reflex? And clinical physiology question could be how this high altitude acclimatization affect the pulmonary function and oxygen saturation. So any specialty, you can have some basic one and some advanced. So some forensic medicine questions are also there, some microbiology. So I'm just skipping these. So after the research questions, once you have formulated the research question, the basic one, I mean the not the refining stage, but after you have done your research question, they laid down the criteria specifically for the population, for the intervention, for the comparison group outcomes, setting, and the specific follow-up time. Then you develop your protocol, and then you focus on search strategies. So search strategies, you focus basically, you say that at least you will search how many database. So at least 2 database search is mandatory. And in case if you don't have access, like in our case, we have access to Medline through Ovid in AIMS Patna, and now the Scopus has been added. So we have got this 2 primary database, and then there are gray literature sources. But primary database, we have to this access through of this Medline, because the Medline you can access through PubMed also and through Ovid also. So PubMed is free for everyone. So at least PubMed all of you can do, and another additional access is needed. So in case if you don't have, I don't know about situation at your end, probably people who are from AIMS or INIs, you must be having access to many databases. At least like many people have got Embase and Web of Science. We'll see all this, but in AIMS Patna, we have got these 2 database right now. Maybe in future, we may have additional. In case if you are thinking of doing, this meta systematic review, and if you don't have as a primary researcher, then you can collaborate with some friend of yours who have the access of the database, and then you 2 or 3 can work collaboratively. Like generally we say that information specialists like librarian, they call in the West, they call this librarian as an information specialist on systematic review. So there is a separate designation and post for such librarian who are very well versed in this process of searching the articles and running the search strategy. But again, in our case in India, we know that generally we have to do all the work. Like, I don't know about Priyanka, how you have done it. Priyanka, can you share your experience of doing it, how you have done it? Probably, or anybody else who has done it already.
Good
How?
afternoon. Ma'am, I had done my SRMA in collaboration with PGIMER Chandigarh, in
Okay,
collaboration with Dr. BK Padi sir. तो उस
okay.
समय at that time I had one of my in my team I had one person who was from PGI MER, and she had done all the database search. I had made the strategy, and after that she had searched for me on 5 databases.
Okay, good. So, like, you took help from your friend who was having that access, right?
Yes, ma'am.
Okay. So, anybody else who has done it or any experience of doing this systematic review, who can share your experience?
Yeah, ma'am. Actually, I have conducted one of my systematic review, and it's ongoing. But basically, I have access only PubMed, Google Scholar, and then I have contacted my librarian, institute library, and he arranged for database. Just I gave my search strategy to him, and he gave me the list of the result and the sheet. So yeah, I did kind of this thing.
Okay, good. So again, you also have collaborated with the information step specialist or librarian, whatever you call. The designation might differ from various institute, but again, that is needed. So anybody, so thank you, Priyanka and Dr. Fazana. Anybody else? Okay, so like what in our case, what happened at that time? Right now, we have got the access to Scopus, but that time we only had access, like you are saying, PubMed. So we had access of PubMed, and we had access of this Medline through Ovid, through our institute library. So we searched that, and again we collaborated with one of our friend from AIMS Delhi. And since they have got this access through this Open Athens, so she helped us in, searching the article like the way you are saying. We also sat with her and helped, like, because, that person should be, if somebody else doesn't know the proper, because search is again very intensive work. I don't know, those of you, it took a lot of our time. Around, I think, for 3 months, we were like crazy in searching, developing the search strategy. And again, running the search. By the time we were done with our searching, again, new article used to come. And every time you run the search, the number of articles were differing because all the other like Embase, Web of Science, and Ovid, they have got their controlled vocabulary, which is different from the PubMed. So that's why it took a lot of our time. And it's good if you can, if somebody is good in doing a systematic research and is information specialist, the way Farzana and Priyanka have done, that is good. But again, if you are the lone researcher, lone means, I mean, you have to do the search also, and you have to synthesize the qualitative and the quantitative evidence also. So the search takes a lot of time. So again, what you can do, even if you have to do, you can ask from, again, do it collaboratively. That will add and that will help you in completion of the task. Otherwise, many times we start off doing it, and then because since it is a resource intensive, it needs time, it needs perseverance. So we tend to leave in between. Let's not do this because, a lot of time is, getting vested in this. So that's why collaboration is a good idea. And now, whenever you are doing this, you should refer to the Cochrane handbook, because that chapter 6 serves as a guide for developing effective protocol and doing the systematic review process also. Because in this 3 days, we are just sensitizing you. So you will be knowing all these steps, but for detail, again, once you are doing it, the more you will know once you start doing it. Right now, maybe whatever I'm talking, I don't know how much sense I'm making it to you. Those of you who are doing it or who have done it, you can understand more. But for the people who are listening it for the first time also, if you start doing it, and then again, these things will become more clear to you. So again, you make a research protocol, ensure that your search strategy and sources are a part of your overall protocol. And this step is very important, that you have to document everything. That means, since I said that it's a long process, 9 months to 1 year or 1.5 years, depending on your research question and depending on how much time you are, devoting. Because per day, see, all of us are doing a lot of work. We are multitasking. Like many of us are there in the medical college. We have got a teaching responsibility, center responsibility. People who are clinicians, you are seeing patient care also. Some admin responsibilities also there. Uh, Even if you are a PhD scholar or a research scientist, then also you have got a family responsibility as well as. I mean to say that, every day you cannot devote like 4 to 5 or 8 hours on systematic review. So again, but if you decide no, every day I'll spend at least 1 hour or 2 hours or even 1 hour regularly, then you can achieve this task. But for that, you should maintain a log, like day wise log. You can maintain, either you can maintain it in the Excel sheet, like if you have formed a review team, on which day you have formed the review team, who are the members, then again you have had a meeting over Zoom regarding the research question, then again you can document it. So keep document all the processes, because then many times you may give it as a supplementary file also. And again, even if you don't give it, it will serve as a good guide for you to take lessons at what point you got delayed. And then when you plan for your next systematic review, then again you can try eliminating those mistakes which you did in the first one. Because we have maintained, initially we did not maintain log, so we had got a lot of problem. Then again we started maintaining log, and now when we are planning for our second, then we will try not to repeat those mistakes which we did in the first systematic review. Because first one, you will see, whatever you do for the first time, it will be full of mistakes. And then once you start doing it, you repeat the same process, then there will be a time point when the mistakes are going to decrease in the subsequent systematic reviews. So be prepared that whatever you do first, it may be with many mistakes, but we should learn to accept our mistakes also. So that's why you should document, but you can only do that once you document everything, otherwise you will forget. So this is the Prisma P, which is the preferred reporting items for systematic review and meta-analysis. It came in 2015, and it gives you a checklist for all the recommended items to be there in your systematic review protocol. Like it should have a title, and it should you should write the update also. Like if it is like Priyanka has done something on some topic and she wants to update it on the same topic. So if this protocol is for the update of a previous systematic review, then also you can identify it. The third thing, like registration, you have to mention, like if it is registered, then you have to provide the name of and the number of also. So this is important. You have to register it in the Prospero, and then contact also you have to provide the name, institutional affiliations, all these things, contributions. This is important. Like who you have to identify the task which is doing what, and then they are writing guarantor, but I don't know. We did not write this guarantor of the review. But again, amendment, if like protocol represents any amendment of a previously completed or a published protocol, that also you have to write. And support, like which data, any financial, this thing is there or no, support for the review, any funding, sponsor, role of sponsor, and then the other points are there, like the objectives and all. So now we'll see the searching. So after this, we'll see the initial free text search. Once I have identified my research question, so after this, after submitting the protocol, or for the submission of protocol also, I should have a broad search strategy. So like this was the question initially what we formulated. What is the association between exposure to fine particulate matter, PM 2.5, and the development of or the exacerbation? So it can be the outcome, can be the development, or it can be the exacerbation of the attention deficit hyperactivity disorder symptoms in children. So I'll show here what is my population. So my population is children. The intervention here, it is not an intervention, it is exposure. So exposure is PM 2.5, the fine particulate matter. The comparison is low or no exposure of PM 2.5. And the outcome is the development or the exacerbation of ADHD symptom. And the time we have not specified, but it is very broad. Again, you see the natural history of disease also. So ADHD development might take years. So again, time I have not specified. I will specify later it on the basis of available study. So whether I want to do it across developmental stages or early childhood or in the teenage after 12 or after 10. So that's what I said, that this is not necessary that all the questions, the elements of all questions cannot be refined at the time of submission. You may refine it later also. So this is the template which we will be using. So you should also create a template like this. We will provide this template to you where you have to identify the concept according to whatever is the research question. So like in this case, if you see, I will identify the concept. So with this question, if you see this research question, the ADHD and the PM 2.5. So what is the key concept which I have identified? So the color which has been marked in red, the words or the concepts that I have identified. Like what is the association between the exposure to fine particulate matter, PM 2.5, and the development or exacerbation of ADHD and the symptoms in children. So three concepts I have identified: PM 2.5, ADHD, and children. And I'll see the free text search. So these are the three concepts. So I will, in the Word document, I'll write these are the three concepts: concept 1, 2, and 3, fine particulate matter, ADHD, and children. And then first let me show you, and then you will search for another question, that is the probiotic and diarrhea. So how I will do it? So I'll start searching it in the PubMed. So what I'm doing in the concept, I'm just populating these concept with this free text search. So let's say this is my so this is the same template which I have shown. This is my template. So I'll start typing the free text here in these three columns. So I have this template. So I have, for what I did, I have identified the concept from my research question. And again, it is not necessary that you identify all the 5 elements of picots. Why? Because many times the exposure, it is here, it is okay, but many times the outcome, in this case it is okay, but if it is an intervention study, the comparison group, whether there is a no comparison control is there, what type of control, it is not always there. So it's better that for good search, you, rather than being so restrictive, you identify the broad concept. So 3 broad concept for my research question was ADHD, PM 2.5 and children. So now I'll go to the PubMed. So I'll type PubMed, and you all should have an account on PubMed. So probably I'll log in here. So this is my account on PubMed. So I'll start with the basic search here. So I'll start typing like PM 2.5. Here I'm just adding some Boolean operators and ADHD and children. We will talk more about these Boolean operators. You know about these Boolean operators, or and. So or we connect when there is a synonym, and we use when there are 3 different concepts. So I'm not going now with the specifics, how do we make search in the database. I'm only telling you how to concept for the free, identify the free text, because you should first populate your concept with whatever free text that is available in database which you are going to use. So let's say I have searched this. So I have seen like there are 10 results with this thing. So I'll start seeing the review. I'll click on this and I'll see the abstract and title, what word they have used for these. So they are writing review on the mechanism between different factors and occurrence of autism and ADHD. So if you see the incidence of neurodevelopmental disorder. So probably this ADHD, they are writing it as a neurodevelopment disorder also. And again, if you see the pollutant, they are writing that these are the pollutant. So these pollutants I'm not going to use, so I'm not writing it. And again, here the keywords, they are writing ADHD. And then they are writing exposure. And here again, the word, they have written the air pollutants. So you can write air pollutants also, PM 2.5 and PM 10. And then if you come down, you can see many times it shows like mesh term. So mesh term, it is not here. So what I will do here, I will write here after seeing this that they have used here for PM 2.5, they have used air pollutant also. So I will write air pollutants, and for ADHD they have used ADHD, and children, if you see this, the population, so children, I could not see any word related to this children or population, maybe in recent perspective. So population, yes, they have written children, parents and prospective parents. So they have used the term children only. If you go and see the next article,
Review article.
so these are the review articles.
Study देखना होगा.
Yes.
Okay.
So if you come down, you can see they have written this mesh terms also. So first you see here, air pollutions and neuropsychological development, a review of the latest evidence. So I'm just doing a search, like, so they have written air pollution. If you see again, they have written fine particulate matter. So that I can write. So I may copy from here, and then I may write here that they have written air pollutants also, and they have written like fine particulate matter. And again, I'll go down and I'll see What are the others? So here also they have written PM 2.5. And if you see the ADHD, they have written neuropsychological development. So this you can also write in terms of ADHD. It will be very broad, but again, right now, since I have to search some broad names, so I may write or you may copy paste from here. This neuropsychological development. So I'll go and I'll paste this term here, neuropsychological development. And children, you know that many people, they use children like child, and if you come down, you can see like at the bottom, they have this mesh terms also. So they have written like air pollutants, air pollution. And then like they have written ADHD, attention deficit disorder with hyperactivity. So this you can, if you click that, this you can copy. Attention deficit disorder with hyperactivity. And substances here also they have used in like particulate matter. This is related to our PM 2.5. So some terms you can see from this also. Here also they have used particulate matter. And if you come, so here terms I will use. So I will take these two terms. Attention deficit disorder with hyperactivity. So you may write instead of ADHD, you can write here attention deficit disorder with hyperactivity. And here you can write like fine particulate matter, air pollutants, that I have taken already. And here you can write like PM 2.5 also, because since it was there from the beginning. Then again you can come. So similarly, you can keep seeing the article so I'm doing the broad search now. So now I'll come to the fourth article. And again, they are writing the impact of air pollution to CNS in children and adolescents. And this you can see they have written like PM 2.5, ADHD. If you see the article, the mesh terms down. So they have written like air pollutants and child. So they have written child you can write. And so then again, air pollutant and child. Child I have already written. Again, you can go to the other next article. And then again, you can see air pollutants and attention deficit hyperactivity disorder. So see, there are two. Initially, they have used attention deficit disorder with hyperactivity. And here they are writing attention deficit hyperactivity disorder. So again, like here, what I'll do, I will write here attention deficit. I will again copy paste this. Attention deficit hyperactive disorder. So this was after this. Hyperactive. It was, I guess, hyperactive disorder. No, hyperactivity disorder. So this is right. Now again, you can come and see here they have used like PM 2.5. And if you see the mesh terms, so they have not given the mesh term here. Again, you can come and see role of this thing, signally PM 2.5 induced neurodevelopmental change in rats. But again, this population is in rats, so I'm not interested. So this is how you do some initial search. Climate change, fossil fuel. Here you can see keywords they have used ADHD. Here they have used attention deficit hyperactivity disorder. And here they have used like children's health or some other like PM 2.5. So they have written particulate matter. And if you see the mesh term again, air pollution, and then child health, climate change, female, these are there. So you can write child health. So here again, child, you can, children is there. Again, if you see later, it may have like pediatric or childhood. So this is initial. If I go with some other, so this I did with PubMed. And I have populated this concept. And again, similar concept I have to repeat with other big database also. So I don't know about how the access in with you, I mean, the case of access with you people, but again with PubMed, at least you can do the initial search. And if I see this thing, this is my completed one. So this process you have to repeat with all other database also. Right now, I am not running the search. I am just running the free text. So if you see, if I have done this free texting, so I have done like PM 2.5, 2.5 concentration, neurotoxin, environmental toxin, air pollutant, air pollutants, air pollution, particulate matter, ambient PM 2.5, environmental pollution. These are the terms I have searched for PM 2.5. For ADHD, I have got attention deficit hyperactivity disorder, attention deficit disorder with hyperactivity. Many people write like attention deficit oblique hyperactivity disorder, conduct disorder. For children, you will find these terms like children, children's, early childhood, child, preschool, toddler, like this. So this is how we search for the concept. So right now I have shown with PubMed, again, since all of you have access to PubMed and you have made account also, so you can start, we have shared one sheet with you. I think template, we have shared the
गूगल शीट और टेम्पलेट भी कर दिए और उसमें से आ जाएगा फर्स्ट है कीवर्ड सर्च पर ऊपर वाला कीवर्ड सर्च पर ब्लैंक डायरिया वाला
Yeah, so this one, if you see, we have shared this template.
लेकिन गूगल शीट पे जवाब दूंगा
But you have, yes, this is a template like concept we have given you. You have to search for the free text or terms for the probatic, for the acute diarrhea, and for the children. These three.
instruction
So I'll tell you how to do this. So this breakout room activity is for searching the free text term. So you have to read the review question, and review question is what is the effect of probiotic interventions on the mean duration of diarrhea and the related outcome in children with acute diarrhea. So the PICOT is this, but again we have given you the concept. So don't go by the PICOT here. And then you have to populate the text free term. Free term means whatever you see in the title and abstract and mesh term which is there in the bottom of the PubMed. You search for that, and right now you use the PubMed. Since I don't know about, because all of you will not be having the access of Ovid or the Embase or Scopus, so you search the PubMed, and in this case you can search the Google and Google Scholar also. We have not told you that, but you can search the Google and Google Scholar also and search for the synonym or the free text in this case. And then again, if you are there in the breakout room, there will be, I don't know how many breakout rooms should be made. Total participants are 47. So maybe 7-8 people per breakout room. And you can, in 8 breakout room.
रिकॉर्डिंग करना होगा ये देख लीजिए अपना हम सबको रिकॉर्डिंग करा ही दे रहे हैं
Yes, so many times participants, they ask for recording of the breakout room. In that case, we have given the recording rights to all of you. Those of you who want to record this breakout room activity, you can record it from your end. Because we cannot give you the breakout room recording from our end because there are many. And separate person are there in separate breakout room, like individual. So that's why we have given the individual recording rights to all of you. Work in a group. Like if one person, so all of you like keep populating these concepts, identify one lead person in your breakout room. Like mentor can do this job. I mean, asking them to identify one person, and then all of you can work collaboratively as if you are starting a systematic review. So searching for a free text terms, this thing in and writing them in the Google form which we have shared.
Google sheet
Google Sheet.
बोलेगा उसको
Akash, sorry, Anand. And I'll show the all the sheets and the concept and the free text term which has been generated by various rooms. So this was the activity of room number 1. So they have given you these words like lactobacillus, if you see. the bacterial probiotic, the Lactobacillus helveticus, synbiotics, Lactobacillus reuteri, Lactobacillus rhamnosus, Saccharomyces. Then if you see the concept 2, which is the acute diarrhea, then acute gastroenteritis, diarrheal episodes, gastroenteritis, persistent diarrhea, antibiotic-associated diarrhea. Now, here, if you see these terms, from there also you have to refine, like whether you will take the antibiotic-associated diarrhea or not. So these are the special refinements. So when you will be doing the free text search, there you can refine your RQ also, whether you will take this persistent diarrhea or not. Because acute diarrhea, if you see, I have not defined it. So if I see that like last three more than 3 stool in last 24 hours, then in that case, will I take persistent diarrhea or will I take the this antibiotic associated diarrhea or not? But right now it is okay. These are the free text term, and based on that you may do your search. Then again, this children, preschool, infant, child, childhood, pediatric, premature birth. Now this premature birth, again you can see whether it will come under this children or not, young children under 5. If you see the room number 2, then you can see like antidiarrheals, probiotics. They have given a lot of names like Saccharomyces, Lactobacillus, synbiotic, probiotic efficiency, therapeutic use, Lactobacillus. If you see the acute diarrhea, gastroenteritis, acute disease, acute infection. So see, if you work in team, you can just see in a span of only 10 to 15 minutes, you have populated this. Children again, child, pediatric, preschool, birth till 10 years, childhood children. Again, if you see the room number 3, again, probiotics, these are the terms, and this is for acute diarrhea. If you see room number 4, they have also populated these 3 concepts. Room number 5, I think other rooms were not there probably. That's why there's no term. But again, it takes time. Right now, you have done it so quickly. But once you are formulating a search strategy, you will spend at least 1 week in populating these search terms. And then once you finalize with this free text term, then you run the same these free text in all the database. Right now, I have not shown you the searching of this free text term in all the 2 other domain. That is the probably Embase database or Scopus or Medline. So that is that you have to write. Again, this was regarding the free text term. Searching of free text. Now there are some questions from the participant. So let me take. So we have shared all these files through a Google Drive previously also. So right now we are sharing it in WhatsApp. But if you see your earlier mail communication, you will find a Google Drive link where all these files have been saved. So even if you can't access your WhatsApp through laptop, you can access it through your mail, through the Drive link which we have shared. Again, Priyanka has written, please share all the documents. Yes, so Dr. Farzana has written like her title was Developmental Delay Among Prenatal COVID-19 Children in exposed to children that are not exposed to COVID-19 infection prenatally. So she has identified these free text term, which is the COVID-19 exposure, children and developmental delay. So that's okay. And again, COVID-19, you can define further, seeing the literature. What will be the article? So initial text term concept, it is okay, but again, you will find more free text term. Then again, if birth till 5 years. So if you see the questions, one question. Then again, we will show you in the Prospero how the registration for Prospero. So we wanted to show you the how to So all of you, please make an account in Prospero. So right now, see, this is Prospero. You may type in Google. Let me show you from beginning. So in Google, you type Prospero and then open this link, Prospero. Here you may create account here, but since I have account, so I will click on this login, and already I have this account and this password. So I'll just go and click on this login. So this login, if you see, if I go and see my Prospero, so it shows you what all you have got registered, a new active, we are registering and amending. So if I click on this registered, so we got this protocol registered in 2021, this 20, effect of economic and non-economic empowerment of women for reducing intimate partner violence. But again, we could not do it. So this we did not start, and we could not we did not start. So that's why there's no question of completion. Then next come your this thing, new active. So this we are planning. I said that we are planning for a new review. So we are registering it here. So that's why we started this process on 4th March. And now this is again, we have registered this association between ambient air pollution and ADHD in children. And this it got completed. So if you see, if I click on this, so you can see the detail about the protocol. So these were the record history. So if you see, we published, we registered this on 2022, and then these many amendment we did on again May, then again March 2024. And it shows you, if I click this, if you go to My Prospero, and if you see this article and ID, if I see this published record, so it shows this is the protocol which we this was the review title, and you can see the changes right now. Can you see we have got this change? So whenever you request for a change, because you can edit this later on, like I said, that you can submit your protocol now, and later on if you find that there is some change in your protocol, you can go and submit this change and it will be accepted. Again, in search also you can see there was one change. So later we did one amendment. So in this, like initially we said that we will search two database, then later we added this Embase and Web of Science also. And then again, if you see the number of collaborators, this we have just data collection, all these you have, once you do it, it will be easy. And then this review team members. Here also you will see that later we added one person from psychiatry. So there was one change in the team also. So my purpose of showing you all this detail is you can edit or you can request for a change later on also in your protocol. And I said that we collaborated with one faculty from AIMS New Delhi for access of this Embase and Web of Science, because we did not have access to these two databases at that time, even the Scopus. Right now we have Scopus, so we can now independently do also using the Medline through Ovid and Scopus database, the two database at least, because it is said that at least two database search should be there. So this is one. Now, there were few slides which was I need to complete. So now there's one question. Is it possible to conduct a systematic review without using a specialized software? What is your take on this? We have given a Zoom poll to you people. Kindly respond. So the correct answer to this poll is yes, we can do systematic review, we can do without software also. Meta-analysis, yes, it is not possible, but systematic review we can do. 51% of you have answered yes, and 31% have answered no, and rest as can't say. So you can, like, we will show you, you can import the CSV file, and in that Excel, you can do a systematic reviews. It all depends on the number of your topic and the number of articles which you get. So if the number of articles are very huge, definitely management will be difficult, but it is not impossible. You can do it. But again, yes, like Navneeta is writing, too much of manual labor is needed. And again, Rayan, if you see, this is free. So you can use Rayan, and it makes management of the data and working across team very easy. So that's why it is good. Again, Priyanka is writing, in our team member registered, if one member was unable to continue, can we remove them later on? Yes, you can make that amendment or changes in the Prospero. You can add, or you can, ask them not to have the person since he has already left. So now the next question is why to use software for systematic review. So like Dr. Navneeta has said, it will be very resource and very difficult to manage with the lead investigator. From the team member, it is okay. But for lead investigator, because you will get responses from all the other people regarding the title abstract screening, then it will be difficult to exclude the reasons and then manage that in Prisma. So that's why it is not impossible, but it is difficult to do without a software. So why to use a software? So basically, since I said that in systematic review, you work as a team. So if you are using software, it helps in doing a collaborative work, which we will see tomorrow in Rayan. So you can invite 3, 4, 5 people, and all of you can simultaneously work in title abstract screening. So it help in collaboration. You can again give them all the criteria, the study inclusion, exclusion criteria. You can chat also in between. Once someone is doing, you can post a question. So it's like a small group of WhatsApp or Telegram in the Rayan, where you can type your text and they can respond also specific to that particular systematic review. So collaboration is easy. The second is organization. So organization, like organizing the data. It's managing the data, organization of the data, the format, the many articles, because you can import 10 files at least, which we'll see. And the huge number of articles also you can manage and organize in case of any software. And it minimizes human error. Why? Because if you are doing it in Excel, and again, you have to transfer that decision from Excel to some other new sheet. So in that case, there might be some error in labeling the reason or extracting the information. So that is done by the software. And again, it helps in blinding, because with Rayan or with many other, why I am taking Rayan many times, because we will be using that. So one team member doesn't know about the decision of the other. So there is an option of blinding, and if you make that blinding on, I will not know on a particular article what decision you have given, whether you have given a decision to include that article or exclude that article. So that feature is there. And you can extract data also. With Rayan, it is not possible, but there are software available. Of course, it is a paid one, which can like extract data from Mendeley or EndNote. and then you don't need to do a manual extraction of the data. So these are a few other options like Covidence, Rayan, SRDR, Cochrane, of course, that is their Distill SR, which are the software which we can use for the management or for doing the systematic review and meta-analysis. So Rayan, we will be seeing. So how does this software work in general? So they are now integrated with AI tool. So like Dr. Hari is also asking, is the use of AI is permitted in case of a systematic review and meta-analysis? So you can use AI also. These software also take help of AI. But again, in case of if you are using some other AI apart from these software, your intervention is needed. That means you need to train the AI. In Rayan also, you will see that at least 50 decisions you have to give. Then only it will make a model and it will apply that decision to rest of the article. And your supervision is needed. You cannot entirely be dependent on the AI. So yes, you can, and you can quote also that. So generally in any software, you import the citations. We will see that like RIS format, or in case of PubMed, it is NBIB, NBIB format. And then you do the title abstract screening. Then you upload the full text, and then you screen the full text, and then you do the data extraction. So Rayan doesn't do the data extraction. It only does the up till the full text screening. And then for data extraction, you can do it manually if the number of articles are less, or you can take help of AI. But again, for that also, the proper prompt should be there, because for AI, if you see those of you who are working, if you don't give a proper prompt to AI, then it doesn't say no. It is again like a computer software. Whatever you enter, it will give you something. But if the prompt is not there, appropriate prompt, then whatever data you get, that is not of any use. So that's why there should be it should be a very well prompted use of AI. Then only you can use the AI in case of a systematic review. So I think with this, we can take a break for lunch, 45 minutes break. And then we will be back at, what is the time? So 2:15. So we will be back by 2:15, and then we will start the search strategy and searching in various databases.
Ma'am, one question, please.
Yes, Navneeta?
Yeah, ma'am, I was worried about like writing birth until 5 years or 2 years for children in the free text search.
Okay.
Wouldn't it be too wide? Like the PubMed will record the articles which have the term, no, ma'am?
When see, you are doing the free text search, when you combine these search with it will reduce the number of articles. Initially, you may find very huge number, but when you will combine these with various concepts, like maybe in case of a probiotic diarrhea and children, so when you combine these concepts, the number will be less. So because we will see in the search, you are not worried about the precision. You are worried about the recall. We'll see in the upcoming session. You want more data to be in. So that's why not that much precise, because people, they all the time, they don't use that much precise word in their title and abstract. So that's why maybe, like I said, in ADHD, that neuropsychiatric disorder. So that is very broad. But again, if you combine with that with air pollutant, it will yield to a lesser number of articles.
Thank you, ma'am.
Okay. So we are breaking for lunch. And I think any other question? So I think.
Can we ask a verbal question? Sorry.
Yeah, please, Dr. Lalit.
Yeah, ma'am, sorry. Ma'am, I was trying to ask a simple thing that manual search is something which, it is a very laborious procedure. And you are, as you yourself, respect, ma'am, said that it might take you a week for a team to, generate those, So are there any software programs that either paid or unpaid, whatever is it, that, which we just ask, say, 2 or 3 of our, important terms like acute diarrhea, children, and, probiotics, and we give it to that software, and they are the ones who generate and come up with the articles or the mesh terms and all that, so that because we don't get teams of 10 to 12 members who will help us out. So is there any softwares that you would recommend, madam?
Exactly, software, because in that particular database, there's no software. I mean, till now, I don't know, because but again, like, you can take help of the information specialist. That means people who are working, like Priyanka has said that she has taken help of a girl who was in PGIMR. So these are the paid services. You can give your broad search term to someone of this designation, and then probably they will give you the link also. And probably Farzana has also took help of one librarian in her institute. So again, with only help of software, just giving the term, it is not possible. Why? Because every database, let's say InBase, that has got a different way of searching. Like in PubMed, we say mesh. I will just demonstrate it in the second half, that it has got like M-tree. Or if you see Scopus, it doesn't have any controlled vocabulary. If you see PubMed, it has got a controlled vocabulary. So different database are having different way to search. So that's why I don't think so there is any software which can give you, just you feed it and it will give you. Maybe in due course of time it might come, but currently I am not aware of it.
Okay,
Any software which can manually give you all the articles, yet there are people, because ultimately you have to run all those free text term in a particular way to get a RIS format, because that format will be imported into the Rayan. So even if, like you are saying, yes, I understand that it is an intensive process, but again, you can take help from the people. And I think few of us know. I'm not aware basically, but I know that there are people, and you can collaborate. Like I said, people are collaborating it across borders also, like maybe people from West or someone who's working. It's a paid service, so you can get it done.
sure, ma'am. Thank you very much.
My pleasure.
Ma'am, are you there?
Yes.
Ma'am, I have a question that I have formulated a topic on systematic review.
Mhm.
As I work on endocrinology, my research topic is gestational diabetes mellitus.
Mhm.
So I would like to do a review on perinatal complications of GDM in Bangladeshi women.
Mhm.
So what I face that there should be at least 2 database that I should search. But
Mhm.
when I search PubMed or other databases, many of the articles does not come up. But there is one thing, that is the JOL, Journals Online Limited, Bangla JOL. And
Mhm.
if I search that database, I can retrieve some 9 to 10 articles.
Mhm.
So should I include Bangla JOL in my database, and I can include PubMed and Bangla JOL, and would that be sufficient enough?
You can include that, and there are ways. I will show you. There are gray literature search also. So these are
Yes.
not database, but that will come under the gray literature search, the other sources,
Okay.
because search is still left. I mean, a lot of topic, it is still there to be covered. So I think by the end of workshop, you will get your answers, Dr. Tanya.
Thank you, ma'am. Thank you, ma'am.